Our next speaker is the Cook County Board President. She has served in that position for nearly 4 years. Prior to that, she served as alderman of the 4th Ward and has been a dedicated community leader all her adult life. She earned her bachelor's degree and her master's degree at the University of Chicago. Ladies and gentlemen, Toni Preckwinkle. Madam President.
Good afternoon, everybody. There we go. Very good. I guess I've been here often enough that you know the drill. Okay. I want to acknowledge all the members of the board of our healthcare system who are here. First of all, Hill Hammock, our chair. He is an old friend and former neighbor. I'm very grateful to him for taking on this challenge. And I understand Mary Guggenheim, Carmen Velasquez, Wayne Lerner, former chair Dave Carvalho, and Doreen Weesey are all here. Would you stand, please, so we can acknowledge you? Unlike Dr. Shannon and I, these folks are volunteers. They don't get paid for what they do, and I want to be sure to acknowledge them for their good work. So our guest today is the Chief Executive Officer of our healthcare system. He received his medical degree from Rush Medical College and trained in internal medicine at the University of Texas Southwestern, affiliated with the hospitals in Dallas. Our guest today spent most of his professional career at John Stroger Hospital. He's not quite a lifer, but almost. He grew up in LaGrange Park and is a graduate of St. Ignatius and Spring Hill College. He's joined today by several members of his family, including his wife, Robin. We're very grateful to her. And I want to say this is a tremendously tough job, and I'm very grateful to Jay Shannon for being willing to take it on and look forward to his remarks today. Thank you.
Well, thank you. Thank you, Madam President, and thank you, Jay and Paul and everyone here at the City Club for giving me the opportunity to come and speak. And just to set the record straight and to clean up things for people who are from LaGrange Park and have a reputation, I actually grew up in LaGrange, but that's okay. I'm very grateful to all the support that we've had from the Cook County Board, the commissioners, the elected commissioners in particular, for their constant, steadfast support for our public safety net system that I hope I'll be able to tell you a little bit more about today. I'm also, as I'll talk in a few moments, very, very grateful for the Health System Board that's given me great guidance and for giving me the opportunity to serve the community that I feel so strongly about. Today, I'm going to be talking with you about some of the more distinguished chapters in our health system's history. Many of these you're familiar with, but I hope I'll be able to tell you some things that you're not familiar with. Now, since this is my first big public talk as the CEO, I'm told you're supposed to open with a joke. But my wife, Robin, says that while there's nobody who can laugh as loudly at a joke, there's nobody who can mangle a joke like I can. So I'm gonna spare you that. And she also says I'm a crashing bore when I tell a joke. So I'm gonna skip that. But as the president said, I'm a proud local and I'm glad to be back in town from Texas. I grew up in a very large family. It took my parents 7 tries before they figured out how to have me. And they had a few more after me, as I'll talk about. My father, one of the smartest and well-read men that I've ever known, was a plastic film salesman who managed to raise a huge family with my mom. He traveled quite a bit. I'm very glad that he decided to join us today. He's my barometer for how I'm doing timing-wise. He has to catch a cruise ship later on from Navy Pier. If I'm going too long, he'll get up and leave. I'm glad my wife Robin is here. I've also got just a few sibs, my sister Meg, my sister Mary Ellen, my brother Paul, and I'm particularly happy that my daughter, Kaylee, is here today. Now, who's not here today, unfortunately, is my mother. She died a couple of years ago, but she was a terrific role model for me. My mom, when faced with some health challenges of my father many years ago, when I was about 10 years old, had the pluck to completely go back and relearn how to be a nurse. Something that she had learned to do before she was married, and then she took a brief 20-year hiatus to have and raise 12 children. She went back and learned how to be a nurse, and she was a nurse for 25 years, very successfully at Mercy Hospital, and I know we've got friends from Mercy here today. But it was my mom's professional satisfaction, the commitment, the joy that she found in her work that she shared with us when she'd come home at the end of a day or a night of work that was very formative to me when I was growing up. I also had key formative educational experiences here in the Chicago area. As we've heard, John Chandler was a teacher of mine at St. Ignatius. At that time, St. Ignatius taught us to be men for others. Now it teaches us to be men and women for others, but that was important for me. I went to medical school at Rush, and even though Rush was right across the street from Cook County Hospital, I never set foot in Cook County Hospital until the very last month of my 4 years of medical school, when I was lucky enough to do a trauma rotation with the legends, in my mind, Dr. John Barrett, Dr. Gary Merlotti, who were critical leaders in what was then the growing regional trauma strategy that really Cook County led for the state of Illinois and the region. I've subsequently seen patients, taught medical students, residents, and fellows my entire career in public academic health systems, and I want you to understand how important those are to us today. Public systems are an important community asset, and they play a critical role for a region for a whole variety of different reasons. And Cook County Health and Hospital System is a wonderful example of blending teaching, discovery, and most importantly, patient care. Everyone in this room, I think, understands the core mission of Cook County Hospital. It's to treat those who come to us without regard to their ability to pay. And we take care of the most vulnerable, and we always have for our entire history. The uninsured, the underinsured, the homeless, those left behind by society. I could talk today about the gunshot victims that we care for, the remarkable work that we do in our burn center, which takes care of some of the toughest cases that we see in the health system. But I hope that you'll indulge me as an internist for a little bit of bias to tell you about some things that you may not be as familiar with about our health system. It's important to recognize that Cook County is the third largest public health system in the country. In addition to that, we're one of the oldest, as I think you've seen from the montage of photos that Karen Stanzik put together for us. We've been around for a long time, first starting as a poorhouse in 1835, and then our first hospital in 1866. You know, in those days, we took care of people mainly fresh off the boat, just as we do today, poor people. Only at that time, they were Eastern Europeans, they were Irish, Italians, Germans, but they came to us for hope and for care, and we gave it to them the same way that we do today. Among the first people we treated were a German girl, now I'm talking about the old hospital in 1866, a German girl with an abscessed hand, and an overnight stay for a Danish immigrant who had cholera. We had a mission to care for those immigrants and their like. And while medicine has changed dramatically since 1866, our mission as a health system has not. The hospital, and up until very recently, it's all been about the hospital. The hospital saw a lot in those early days. We took care of people with all kinds of crazy illnesses, but we learned from them, and we learned that we had to innovate even in the early days. Thus, in 1935, we started the first blood bank in the United States under the leadership of Dr. Bernard Fantis. In 1966, we started the first regional trauma center in the United States. Interestingly enough, for the history buffs here, that was with the support and guidance of first county board president and then later Governor Richard Ogilvie. And while patient care has always been the most important part of the three-legged stool that we think about in academic health centers for us, medical research and education has been key. And I want to tell you a little bit about that because while in those early days, like every other hospital, we were learning to try to take care of in a pre-penicillin era things like diphtheria, influenza, tuberculosis. When you fast forward a century later, work in our intensive care unit in the Stroger Hospital led to a practice, the daily bathing of intensive care unit patients with an antiseptic solution that is now used by more than 30% of the hospitals in the country. That discovery was done at Cook County Hospital System. Working with the Centers for Disease Control and Prevention, we initiated and showed the benefit of rapid HIV testing in emergency department and ambulatory settings. That testing allows you to get a result and inform an individual about the results at the same visit instead of a return visit 2 or 3 days later, which is how it was when I started in medical training. Today, those findings have helped to inform the CDC for the recommendations of standards of care that are used today in HIV testing. Now, in another dimension, you may not think of Cook County Health and Hospital System when you think of cancer treatment, but you should. Every year, we treat 1,600 new patients with cancer, and we don't just treat them well, we treat them with standards of care, including enrollment in clinical trials. Since 2002, we've been a National Cancer Institute funded research center for the care of people who have cancer. And it's important to recognize that, like so many things in our society, cancer is not an equal opportunity killer. It's disproportionately borne by poor people and people of color. And our leadership of our oncology division has found opportunities to bring in extramural funding to allow us to figure out how to treat those folks better. The President and I were at a Survivors Day celebration on Sunday where we saw some of these survivors. And I have to tell you, it's a very, very compelling kind of thing. We just found out that we have been re-upped for another 5 years by the National Cancer Institute. And when the American College of Surgeons Commission on Cancer recently visited us, they acknowledged that while our patients often present to us with more advanced stages of disease, stage for stage, the outcomes of the patients that we care for are as good as any academic health center in the city. And we're very, very proud of that. I think you're also aware that we're known for our exceptional medical training, and this is something that we're known for not only nationally, but in fact internationally. We're the place where nurses, respiratory therapists, pharmacists, and physicians want to train. And when those doctors and nurses and other professionals get together, wherever they land, if they mention to people that they trained at County, they get a particular nod of respect that's well earned. Just to give you a sense of the competition for training at our place, this year we had more than 1,300 applications for 17 spots in our emergency department training program. In addition to that, we're the home of the only toxicology training program in Chicago, this fellowship. Through a unique partnership between our health system, the University of Illinois, and the Illinois Poison Center, we administer the Toxicon Institute. That's the regional poison center, but it's also a training site where every emergency medicine resident in the city rotates for 1 month a year. In addition to that, Stroger is the only dedicated trauma training program in this city. And just this past June, and I'm particularly happy about this because of my father's Navy service, just this past June, we entered into a very unique training program with the Navy, where they're sending their nurses and their doctors to work alongside ours in our trauma center to learn how to better take care of casualties that they encounter serving the country. We're only the second civilian hospital in the country that's been asked to do that. We also train physicians in dozens of other specialties, and our graduates, importantly, are much more likely than those of most academic health centers to go on to a career where they treat people where healthcare disparities and economic disparities exist. Our graduates are much more likely to work in that space. I'd encourage you, the next time you go to see your doctor, ask the doctor if he or she trained at County. I think you're going to find out that either they did, or they spent some time there, or someone else in the place did. And if you go to any of the major centers in town here and you look through the training of the medical staff, you're going to see county's fingerprints all over those people. But I want to point out that while discovery and while education are key to our mission, and I think key to the mission of all public systems, because we know about our patients and the problems that they have, so we know how to ask the right questions, patient care is at the core. And delivering on that mission is a group of highly, highly talented professionals who come to a place that's not always as nice, not always as clean, where things aren't always as bright, but they come there with alignment of mission. What kind of volumes do we do in a system like this? Well, last year we treated more than 300,000 individual patients across our system. We had more than 1 million outpatient ambulatory visits, 25,000 inpatient stays, and more than 130,000 emergency department visits. That's more than 300 people coming through our ED every day, 365 days out of the year. Our experts provide care at the core center. We take care of the largest proportion of people affected by HIV in the city and in the state. And we do that with better control of the disease and better empowerment of those patients with their chronic condition than national and state and regional averages. Our pharmacy, I met a gentleman from Walgreens while we were getting ready for lunch today. Our pharmacy is a wonder. It fills 1.9 million prescriptions each year. On an average day, that's 20 times what your average Walgreens or CVS does. And we do this well. We've done it in such a fashion that we've got full accreditation from the Joint Commission for Stroger Hospital, for Provident Hospital, and for our ambulatory network. We've got special certification for the care that we give to individuals with heart attacks, strokes, cancer, and burns. So we're a resource, and in addition to all those things, and I know Mike Masters is going to be here in a couple of weeks, we're also a regional center in the case that we have a regional disaster. Now, the thing that I want to talk with you about in addition today is the new chapter that we're writing as a health system, because what I've described so far is kind of what we've been doing since our inception in the 19th century. But the new chapter is around the response that we have to a changing healthcare environment, specifically around the challenges and the opportunities that we saw with the Affordable Care Act when it came out in 2010. This is the sweeping legislation that, as a key portion of it, affords an opportunity for Medicaid coverage for single individuals between the ages of 19 and 64. That's a new thing. It's important to understand that, contrary to some opinions, the federal legislation of EMTALA that allows anybody to go to an emergency room is not the same thing as having access to care. This year, with the opportunities afforded under the Affordable Care Act, we saw an opportunity, because the arrival of the Affordable Care Act said we're going to expand Medicaid in January of 2014. Interestingly, the Illinois General Assembly decided in 2011 that in the county of Cook, anybody who had Medicaid had to be in managed Medicaid starting in January of 2015. Now, these two occurrences happening outside the health system, if you will, could have been a perfect storm that brought us to our knees. But instead, it challenged us to think differently and, more importantly, to act differently. We were at a fork in the road. Either we could sit back as a provider of care, watch the patients that we had traditionally cared for sign up with other plans and try to get care with those other providers, or we could show our continued understanding of them, our continued loyalty to them, and a determination to be not only clinically relevant, but financially viable by developing a health plan. And that's what we did with County Care. Many people said that the day of the Affordable Care Act going live would be the day of reckoning for public health systems. But the fundamental misconception around this, that our patients would leave us and go to other centers, is built around a couple of fallacies. One of these is that those centers wanted to take care of these individuals. And I would challenge you to think about that. I'm not sure that they do. Secondly, was that they could. remember those numbers that I've told you about, and I'm going to repeat them in just a minute. It's really important to understand that in a region as complex as Chicago, we're really in a regional health ecosystem. And disturbances to the balance of that ecosystem can have ripple effects that are absolutely unintended. Expecting the rest of the local health ecosystem to absorb 1 million ambulatory visits, 134,000 emergency department visits, 1.9 million prescriptions, 25,000 admissions to the hospital, and not unimportantly, to provide what we did last year, $500 million in uncompensated care, is not only, I think, a leap of faith, I think it's unrealistic. So we applied for, and with the support of the President, with the support of our federal and state legislators, we applied for and received the 1115 waiver in 2012. That gave us a 1-year head start. It gave us all of 2013 to start signing up people for the Affordable Care Act Medicaid expansion. At your tables today, you're going to see a brief synopsis of our success in that regard by the Kaiser Family Foundation. I'd urge you to take it home and read it when you've got a few minutes. Even though people thought we were crazy and we wouldn't be able to deliver on the promise that we made to try to enroll 115,000 individuals, we were successful. I started back with the organization in February of 2013, and the county care office was right next to mine, and I can remember us celebrating when we had 10,000 members. Today we've got 106,000 members, and we've reached out to and initiated applications for more than half of the individuals in the county who are eligible for the Medicaid expansion. But it's important to recognize that that enrollment was in fact, and in retrospect, the easy part. The challenging part is creating a network and actually delivering on care. We could pat ourselves on the back that we've got a lot of members, but if we don't deliver care, we don't do well. Now, how are we going to do that? Geography is destiny. We're on the west side and we've got 16 franchises across the county. So that wasn't going to work. So we reached out to our federally qualified health center partners. These are community health centers that have always been mission aligned with the health system. We've always worked closely with them. And we brought every one of them into our network of care. We reached out to their affiliated hospitals. And so today, the network that is county care is described by that. We have 130 franchises across the 940 square miles of Cook County to provide easy geographic accessibility. And we have more than 30 acute care hospitals, including all the major academic health centers in our network. It's important to recognize that 2/3 of the patients in this health plan are getting their primary care not in the Cook County Health and Hospital System, but in the federally qualified health centers that are part of our network. They contract with us, and we pay them for the care that they receive. So today, County Care is a $1 billion startup with more than 100,000 members. It's the fastest growing Medicaid managed care plan in the country, in the state, I'm sorry, and one of the fastest in the country. Now, the important thing about that is you hear about these numbers and you see stories about the finances of county care and the finances of the health system. What gets lost in that is we're talking about 100,000 individuals, and there are people. Now, we're lucky enough to have today with us one of those people, Richard Romanofsky. I'm very glad that he allowed us to tell his story. Richard's a 62-year-old musician. He was working all his life, but he wasn't making enough to afford insurance, and he has some chronic conditions, including diabetes, high blood pressure, and a swallowing disorder. And he was inhibited from getting the kind of care that would allow him to ply his trade. He's a musician, and a pretty good one. It inhibited him from being able to get the care that he needed because he had a hard time coming up with the copay. He got enrolled in county care, and he was lucky enough to enroll in one of our excellent partners, Erie Family Health Center. And he wasn't just that lucky, he was lucky enough to actually get a county grad, Dr. Lee Francis, as his physician. Lee and I both kind of cut our teeth at county in the early 90s, and Lee is a terrific, proud county grad, and he's running an excellent health system with Erie. But now Richard has the ability to see Dr. Francis when he needs to. He gets the care that he needs that keeps him well. It allows him to continue working, continue playing music. So I'm thrilled that he and Dr. Francis could come here as kind of the human face behind all of those big numbers. Now, the important thing to understand along with this is that when you start building a health plan of this size, it's complicated. It requires a lot of expertise. We and every other health system that are in this region are challenging with the whirlwind pace of change that's happening with healthcare in the country and healthcare in our region. We and county care are going to have some bumps along the way, but I think we're going to be successful. I want you to think about this. 100,000 people with insurance who a year ago didn't have insurance. That's bigger than the population of Schaumburg. It's twice the size of Orland Park, and it's 4 times the size of Rolling Meadows. And when you think about this kind of size, this kind of program, think about the fact that it's happening across the county of Cook, one of the biggest counties in the country. We have only 4 zip codes in this county where we don't have county care members, so we're everywhere. These are your friends, your neighbors, and coworkers. County care is important because it gives these individuals dignity, gives them the right to have a doctor they can call their own. They can call when they need a preventive checkup. If they need to go to the ED, they're now insured. If they need to get a CAT scan or an x-ray, they're now insured. And that's a big deal. And we hear every day, I've heard it from Richard, I've heard it from others, we hear every day of the measurable improvement in dignity and self-respect and empowerment that our members feel because of that card. We're also doing innovative things that we think are also helping the community. Just as one example, we've initiated applications and now have enrolled 5,000 county care members through the intake process at the Cook County Jail. As you've heard from Sheriff Dart at this podium a few months ago, the Cook County Jail is the nexus of poverty, low education, substance abuse, and mental health problems. It's estimated that 1/3 of the individuals in the jail at any given moment have serious behavioral health problems. Now we, in conjunction with a community partner called TASK, are hooking up those individuals with behavioral health when they leave the jail, hopefully to break the cycle of recidivism that really oftentimes comes around because a person couldn't get into substance abuse treatment, couldn't get their psychotropic medications. So these are some of the great bounties, I would say, of the Affordable Care Act. But even with all these things done, we've got a lot left to do. And even with these very, very important changes that are happening, there's a lot still changing in the health system. One of the important things I've been stressing to my leadership team and to frontline staff in the last few months is the fact that for the first time in our history, our health system has now more insured patients than uninsured patients. This is unheard of. By the way, don't thank me for that. Thank your legislators and finally waking up in the Affordable Care Act, I think. But importantly, now we have to prove our relevance. We have to control our destiny by making our health system a place of choice as opposed to just a place of last resort, if you will. And we do look at the investments that we're making in the coming year as a way to manifest that. So we're bringing on centralized scheduling. We're bringing on a call center function. Those kind of creature comforts that will connect the demand that patients have, insured or uninsured, and the capacity that we have in our wonderful health system. It's been a very interesting and fast-paced journey that the organization's been on in the last couple of years, and frankly, it'd be hard for us to do it alone. We've had excellent input, and I want to publicly acknowledge the assistance and the guidance that we've had from the Civic Consulting Alliance. They and the pro bono partners that they've brought on have helped us to develop many of the strategies that are helping us to become and remain more relevant as an asset to this community. They helped us to assemble a key senior leadership team. Our senior leadership team is experienced, and it comes from here and it comes from across the country, big systems and small. They're here today, by the way, because they got lunch, which they usually don't get when they're having a meeting at work. And I think it's an important evolutionary step for our health system that we now have an independent health system board. Our board is comprised of some of the smartest, most compassionate, and toughest people that I've met. This group of 11 volunteers comes in with business, healthcare, and management experience, and they come in several times a month to be in the very transparent world, the fishbowl that we call our boardroom. They get a cup of coffee and a bagel. If they're lucky and they get there early enough, they may even get a parking spot. Sometimes they don't. But they come in to fulfill a role that has no glamour associated with it. They take a lot of pot shots. They have to ask tough questions in a very public, very transparent environment. It takes a thick skin. It takes a stiff spine. And I'm grateful to these individuals. They've given us a new direction that's allowed us to improve our services, a new direction ambitious enough to swing for the fence and develop our own managed care health plan. They give us a direction that helps to get us the resources that we need to care for those, even those who remain left behind, and there are a lot of them, from coverage under the Affordable Care Act. They give us the direction to guide our budget from year to year, and a budget that this year has serious intentions built into it. It isn't lost on us that as a result of county care, our revenues have increased significantly in the past few years. But I want you to understand, because this is sometimes lost in it, those revenues that come in immediately flow out to pay for the care that our members are receiving across our network. We get paid a monthly fee, whether they're well or whether they're ill, and we pay for their care regardless of what they need. Next year's budget anticipates a membership of 150,000 members. That's because in addition to the Medicaid expansion adults, we'll be bringing on the traditional Medicaid populations, seniors and persons with disabilities, family health plans, the so-called moms and kids. And we're going to be able to serve all of them with our network and serve them effectively. But beyond county care, it's important to also recognize, and this is one of the challenges about being in the public sphere, that there's a lot of service, a lot of work that we do for which there is no reimbursement. I'll just give you a couple of examples. The county is obligated to provide care for those people who are detained in the Cook County Jail and the Juvenile Detention Center. If a detainee comes into the center, whatever insurance that they have is suspended and we can't bill it. That's just the way that it goes. Each year, that costs us about $65 or $70 million, and we have no way to recoup those funds. Similarly, our Department of Public Health, which serves the suburbs outside the city of Chicago, but the suburbs of Cook County, does critical work. It gets immunization out to kids. It does the food and the restaurant inspections. Hopefully Maggiano's is up on theirs. It makes sure that we've got clean, safe water and that we don't have lead in public spaces in the paint. We can't bill for the services that we do as a public health department. And again, that's a budgetary expense of about $11 million a year with no way to bill it. Most importantly, we continue to care for people who have no ability to pay for their care, even under the ACA expansion. Last year, that amounted to over $500 million in uncompensated care. Now, every system in the city does its bit with uncompensated care, but no one in the city, no one in the state does anywhere near that kind of book of business that we do. And it's important to recognize that when we pay those network providers, including those health systems, for the care that they give county care members, they're able to use those revenues to invest in their own systems. And so it really provides stability to that ecosystem that I was describing to you before. So these are the expenses that are at the heart of a complex mission. These are the expenses that require ongoing and continued Cook County taxpayer support. I'm unashamed to ask for that. It's our responsibility, and it's my responsibility as the leader of the system, to do everything that I and my leadership team can do to make that requirement as modest as it can be. But I don't think it will ever go away. We need to understand that we're going to need to continue until everyone in the country is covered, so to speak. So we're a mission-driven organization with big goals for our future, and I hope I've shared those with you today. But I think the thing that I want you to remember is that in the background of all of that is we're a community asset. You don't want to live in a community where the people who are serving your meals, the people who are mowing your lawns, the people who are babysitting your children don't have access to good health care. So I hope I've delivered on that goal today to tell you a little bit about this storied public health system and what a noble and rich history it has. It's a public health system that's cared for many of our immigrant grandparents and great-grandparents. It's a system with some of the most dedicated, talented medical professionals that you're going to find in this city, and it's got committed leadership. It's a public health system that has forever influenced the world of medical research with discoveries that have immediate clinical applicability. A public health system that continues to train physicians, nurses, respiratory therapists, radiology technicians, and the like. And they're far more likely to work in poor areas when they finish their training than those who train at other organizations. It's a public system that continues to care for every patient who walks through our doors, insured or uninsured, documented, undocumented, homebound or homeless, young or old. It's a public health system that is currently writing another chapter in this iconic history, featuring people like Richard and Dr. Francis. The most important thing I want you to leave today understanding is it's our system. It's a public good, and I'm immensely honored to be leading it. Thank you for your attention today. Let's remember that one sign of a civilized community is how it cares for its least fortunate. I'm proud that we have the Cook County Health and Hospital System as the response to that challenge in our area. Thank you.
There'll be a quiz in a week, so a lot of facts. And Dr. Shannon, we'll have you back next year. We'll, make this an annual thing, as long as you're there. I mean, this is Cook County, and is Freddie LeBed like the head of it now? Okay, I will definitely have you back. Questions? Where's our? Oh, right off the bat, City Club P. This is from Vince. Vince. Read that last name. You know how to read bad writing.
As a recovering ward clerk, I can read anybody's handwriting.
What's the name?
Vince Headington.
Headington, as I said, Vince Headington. Very good. How has the Medicaid expansion under Obamacare impacted County Hospital in the area of mental health?
So this is an excellent question, and it's an important one. One of the wonderful things about the Medicaid expansion is that it includes a whole panel of required benefits, and one of them is mental health. So the beauty of this is that county care members have access to a broad network, again, regionally convenient, a broad network of psychologists, social workers, psychiatrists, substance abuse treatment to be able to help with that. I think the challenge for all of us is trying to figure out, okay, so what do we do for everybody else? Because we still have the same challenges of reductions in funding for mental health across the country and in the state. And so for the people who do not have insurance, we still have very, very significant challenges. We're trying to address that by building a network that will work for the patients that Cook County Health and Hospital System serves, but it's a major challenge without anywhere near enough funding right now.
We have two questions, and then we'll have the drawing.
That's really what everybody came for, right?
No. You knocked it out of the park. Yonina? Good. Gotta have easier. Jackie, I don't want you chicken out now when you take over next week. These names are not, Yonina, great. What measures will the hospital undertake to maintain its reputation as a competitive institution for its employees?
I think that's a good question. So we have to, it's actually very interesting. Every 2 weeks we have a new orientation at the health system, and I go down and I talk to the new orientees. I talk with them about the transformation of the health system, and I talk with them about the fact that we now have a majority insured population, and because of that, insurance is directly related to choice, and that our patients can leave us. But then I draw the link with the fact that the behaviors that we exhibit as staff members, as providers of care, that enhance patient loyalty and patient satisfaction are exactly those same behaviors that make me a good office mate or make me a good doctor to work with for the nurses that I work with. And that the opposite is also true. We have a leadership development program that we're doing under the leadership of Gladys Lopez, our director of HR. And in that program, we give the managers that we're training about leadership skills a book called The Patient Comes Second. And the authors of that book had the insight to recognize that you cannot deliver good care that people will come back for if when the patient turns around, you're poking your coworker in the ribs and giving them a hard time. So we're trying to do things to make it a better place for the staff and for the workers. I will say that I think the vast majority of people come to us because they're mission aligned. And it is an incredibly fun, incredibly rewarding, and challenging place to be. We've got the most diverse workforce and the most diverse patients of any place in the city. I'd measure even perhaps in the country. And that makes it a blast. I mean, I wouldn't be at county for as many years as I have been if I didn't enjoy my work. And it's a wonderful place to work.
Last question. This is from Thomas McElroy. Level 1 Global Solutions. Where are you? I know where you are. I just want to make sure everyone else knows. This is not a sandbag question. Dr. Shannon did first time here. Next time we'll sandbag him, Fred. Just don't worry about it. How will the Bureau of Health, why don't you read it? I can't read it.
Okay. All right, so the Bureau of Health, which we're not any longer, we're now the Cook County Health and Hospital System, coordinate technology infrastructure improvement with the Illinois Medical District. Any current plans? So I was just sharing with Terry Mazzani. I was at the Illinois Medical District Commission just this morning, and they're doing wonderful things on the west side. It's not the sleepy little backwater that it used to be. And included in the developments that the IMD is leading are the development, first of all, of the old Chicago Medical School property. This is at the Damon, Harrison, and Ogden intersection. And they're going to be putting in a destination that will include laboratories, physician office spaces, hotels, housing. As part of that, and as part of the broader development of the region, they have also already started putting in ultra high-speed cable. I'm not an IT guy, but it's really fast, and it goes around. It goes around the entire district, and I think everybody's going to be able to latch onto that. I mean, I think everybody is aware that technology has transformed the healthcare system. We're going to have to keep up with that, and we've got a very strong IT team led by Donna Hart, who's here today, and we will be working very closely with the IMD, as with our partners in the IMD, Rush, University of Illinois, and the Veterans Administration Center.
How about a big round of applause? Great job.